Okay guys, so this is the Feldenkrais chair neck and shoulder release. So it's a spinal twist release. So you need a chair that has a back on it and enough space to sit at like a 90 degree. So I am a 90-degree hinge at my waist and a 90-degree hinge at my knees, and my feet are flat on the ground. So for this one, you're going to first sit nice and straight. And then you're going to turn your head as far as you can go without pain and find a visual marking as far to your periphery, that side, as you can. And then you're going to come back to center. Now you also need to find a gazing point directly in front of you. And now we're going to take a deep breath in, and we're going to exhale and keep our gaze on the point right in front of us, but come back as far as we can to the side, keeping the gaze forward. And then slowly coming back forward. It's okay to get a little dizzy, that's normal. It shows that you have some ocular weakness that needs to get stretched. So again, we're going to turn the head back, but keep the gaze forward on that non-moving point in front of you, a drishti in front of you. And when your gaze starts to want to come back, you just draw your head slowly back to center. And again, big deep breath in and exhaling, keeping the gaze on that non-moving point, but moving the head as far as you can without your gaze following. And then coming back. And you'll notice your eyes want to do a lot of funky stuff. And then big deep breath in, and this time turning, but your eyes are coming with you. And see if your gaze and your movement is further, if you have a new spot behind you. Usually we do have a little bit deeper rotation, a little bit deeper mobility. Awesome. So now we're going to do the other side. So same thing. We're going to turn our head, bringing our gaze with us, and then all the way as far as we can to our periphery behind us, finding a spot, making note of what that is, and then slowly coming back to center. Find your drishti in front of you, your non-moving point in front of you, lock eyes, and then keep your eyes there, but let your head turn back. Head turns, eyes stay, eyes stay. Good. And turning back to center. Big deep breath in. Exhale, turning, keeping the gaze forward. The head rotates back. And head comes back to center. And breathing in, keeping the gaze forward. Head turns, gaze remains. Head comes back to center. Big deep breath, turning, but now the gaze comes with you. Seeing if you've gained some mobility or a little deeper gazing to your distant shoulder here. And coming back to center. So this is an awesome one that you can actually continue through the spine. So you keep doing the same thing. You make sure your feet stay square, hips stay square. And this is where the back of the chair comes in. And so we twist and rotate as far as we can from the base of the spine. And see how far back we can see now. And then we come forward and we find our non-moving spot. And we twist, but we keep our gaze forward. And again. So we're going back and forth. My gaze really wants to follow me right now, so I have some ocular work to do. I've been on my phone creating content for you guys too much. And again, now this time we go all the way, and see if you have deeper mobility or a more far gazing point. All right, we're gonna do the other side. Big deep breath. Inhale, exhale, and rotate. Find your spot. Your gaze has come with you. Seeing how far behind you can see. And then we come back to center. And we find our gazing point. And then now we turn, but our gaze remains in front of us. And turning to center. And rotating, keeping the gaze forward, body turns. When you really stretch yourself here, it should be a little uncomfortable. Like I said, it's normal to get a little dizzy. That's not uncommon. Last time, turning back. And now gaze comes with you. See if you've gained. See if you feel like an owl who can turn their head all the way around. So that's the Feldenkrais chair method to gain spinal mobility, ocular mobility, rotation of the spine. Again, you can do 3 to 5 repetitions of that. So always, first one, gaze comes with, 3 times, gaze remains forward, and then final time, gaze comes with. So that's what you want to do. And again, you can work it through shoulders, work it through hips, but you want to keep your base of your body squared. All right, hope you guys liked it. And it's also a really nice way to alleviate pain, increase mobility, and it's not painful to do. So it's subtle and awesome.